Now for a clinical correlation. This clinical correlation relates to the superficial temporal artery, and there is a condition referred to as superficial temporal arteritis, and in this condition the superficial temporal artery is going to be inflamed, and when it becomes inflamed it will have some associated symptoms. One of the symptoms of this inflammatory state is a throbbing headache on the involved side. So here we're looking at the left superficial temporal artery. So if this is the inflamed artery, then that throbbing headache would be on the left side. The other symptom that can be associated with this clinical condition is the scalp on the involved side can have increased tenderness. So it's very sensitive to touch because of the inflammatory state. Another clinical correlation to be aware of is carotid artery disease. And so in this particular clinical situation, we're looking at atherosclerotic buildup. If there's substantial narrowing and then ultimately complete stenosis of the carotid artery, that can result in stroke symptoms. So that could be a thrombus that forms that completely obstructs the carotid artery system. It might be an embolus that would then occlude the atherosclerotic narrowing. Some of the symptoms then in this situation could include sudden numbness or weakness, and this would typically be ipsilateral on the same side. A patient may have difficulty speaking. There may be associated visual disturbances. A patient may have episodes of sudden dizziness, and there may be sudden severe headaches, again, when this becomes very severe.